All right, guys, we have a desired minute ventilation equation. We may have briefly covered this, but I wanted to make sure we are digging in and getting a little bit more detailed with it. So I'll jump in and start reading this problem. During mechanical ventilation of a patient with COPD, the PaCO2 is 60, minute ventilation is 5. The desired PaCO2 for this patient is 40. To what should the minute ventilation be changed to? So that equation is going to be desired minute ventilation equals known CO2 times known minute ventilation divided by desired CO2. Okay. We don't know what minute ventilation we're going to use. Our known CO2 is 60. So we know that our COPD patient has some high CO2. Our known minute ventilation is 5. And our desired CO2 is 40. There's no parentheses here. We're just going to work left to right. 60 times 5, 300 divided by 40. 300 divided by 40 is going to be 7.5, and this is in liters per minute. And that is how we would work an equation for a desired minute ventilation. All right, guys, we're going to do an equation to solve for desired respiratory rate or frequency. A patient with CHF is being mechanically ventilated. The patient's current CO2 is 26 millimeters of mercury, and the ventilator set rate is 18 per minute. The desired CO2 for this patient is 35. To what should the set rate be changed? Okay. So our respiratory rate here, we don't know. Our known CO2, 26, that's kind of low. Our known respiratory rate is 18, and our desired CO2 is 35. So 26 times 18 468 divided by 35. Is 13.37. Let's round that to 13. And that's going to be breaths per minute. So we would just change this patient's respiratory rate from 18 to 13, and we're going to get that desired CO2. All right, we're going to solve for tidal volume. We have a patient with pneumonia and COPD that's being mechanically ventilated in volume control CMV, tidal volume 500, current CO2 of 60, and we want them to have a CO2 of 48. It looks like we are allowing for a little bit elevated CO2. So we know that the normal range of PaCO2 is 35 to 45, and we're allowing for a little bit of that to be elevated. And we'll just jump right in here. So we don't know what tidal volume to set, but we do know that their current CO2 is 60 and their current tidal volume is 500, and we want their CO2 to be 48. Sixty times 500 is 30,000. 30,000 divided by 48 is going to be 625. And that's in milliliters, guys. So what we would do to get our patient's CO2 from 60 to 48 is we would increase that tidal volume from 500 to 625. All right, guys, let's look at another question from your study guide, and let's compare tidal volume range. So I'll jump in and start reading. A male patient with an ideal body weight of 70 kilograms with no history of pulmonary disease is brought into the emergency department for treatment of a drug overdose. He is intubated and placed on mechanical ventilation, volume control, CMV, respiratory rate of 14, tidal volume of 410. His ABG has a low pH of 7.33, high CO2 of 55, and a bicarb that is normal at 24. The most appropriate action to correct the acid-base disturbance is which of the following? So for me, the first thing I do when I look at this equation is I want to take into consideration the ideal body weight, and I want to look at my tidal volume and see if that is appropriate. And so to do that, I'm going to create my ranges. Now this is a drug overdose patient with normal lungs. So our range for normal lungs is 6 to 8. So I would multiply 70 times 6, and then I would multiply 70 times 8 to get my ranges. 70 times 6 is 420. 70 times 8 is 560. So here are my ranges that I could properly ventilate this patient for tidal volume. And it looks like we are not even in an appropriate tidal volume range for this patient. It's low. So I would bump up the tidal volume. And for this question, I would look at my answers and see if there's any selected tidal volumes or tidal volumes that I can choose within that range as an answer. And then I would choose that. All right, what are you supposed to do when your tidal volume range has been reached? Let's read the problem. A female patient with an ideal body weight of 60, no history of pulmonary disease, on the ventilator, volume control CMV, respiratory rate of 13, tidal volume 480, PIP of 4, FIO2 of 40%. ABG results, we got a high pH 7.3. We have a low pH 7.3. High CO2 of 55, O2 is normal, bicarb is normal at 25. What should the RT do? So the first thing I'm going to do when I look at this problem is check out my tidal volume. So we have 480 here, but what is our range? So 60 for ideal body weight. For healthy lungs, our range is 6 to 8. 60 times 6 is 360. 60 times 8 is 480. So we have reached our limit here. We can't go any higher. So the next thing we're going to look at to effectively ventilate our patient is going to be respiratory rate. So minute ventilation is respiratory rate times tidal volume. So let's focus on our respiratory rate, and we'll just start plugging in some stuff for this equation here. Our known CO2 is 55. Our known respiratory rate is 13. And we want to, it doesn't give us what we want, but we know what normal range is. So normal CO2 is 35 to 45. This patient has normal lungs, no history of pulmonary disease. So let's just put it right there in the middle at a CO2 of 40. 55 times 13 is going to be 715. 715 divided by 40 is going to give us 17.8. And since we have to pick a number to set on the ventilator, we're going to do it a little bit lower at 17 breaths per minute. And that's going to get our patient CO2 where it needs to be within normal range. All right, we have a pretty complicated equation. So we want to know what to set this patient's PIP at. So we're in pressure control, and it's based on the patient's compliance. So a male patient with an ideal body weight of 80 is intubated in pressure control rate of 14, PIP of 26, tidal volume that is resulting from that PIP, right? Because we don't set tidal volume in pressure control, is about 470. ABG results, we have a pH of 7.36, which is normal. CO2, 44, normal. Bicarb, 23, normal. Patient's good. Now, 48 hours later, on the same settings, we have an ABG result of a high pH of 7.5. CO2 that's low, and it's at 30, and a bicarb of 22, which is low normal. Tidal volume that we're getting from those previous settings, 750. So what do? So the first thing we're going to look at is, it's always a good idea with these problems to start with ideal body weight and give yourself a range to work from. Okay, so we know 80 kilograms. Our range for this patient, we don't have any health issues listed here. We just know that they're intubated, so we're going to use the 6 to 8 range. 80 times 6, 480. And then 80 times 8, 640. So here's our tidal volume range. Now, because we're in pressure control, we need to take into consideration compliance. So let's not forget that compliance is change in volume over change in pressure. So for this, let's look at the first volume and pressure. We have a set PIP at 26. And our first tidal volume was 470. So 470 with a set pressure of 26. Again, we're talking about compliance. So for this, compliance equals 18. And that's for the past. Now, current, or now, so we have 750. So we're getting that from the tidal volume. So tidal volume of 750, our settings are the same. So current compliance is at 28. So that's the change. We went from 18 to 28 here. Now we have another equation we're going to look at, and that is desired PIP. We'll say D represents desired. That's going to equal desired tidal volume over known, we'll say K is for known, compliance. So we now know that the compliance is 28. We have our tidal volume ranges here. We can figure this out. What do we want to set this PIP at? So we're just going to pick a tidal volume between the range. We got 480 to 640. I'm going to feel comfortable with a 510, right? We have a high, we have a low CO2 here, so we're gonna want to hold on to some of that CO2. And we know that the current compliance is at 28. So let's change that PIP from 26 to 510 divided by 28, 18. So now we know what to change our PIP, our pressure, for pressure control to. We went from 26 to 18 so that we can hold on to some of that CO2 and correct that patient's ABG. All right, guys, we're going to work this problem to figure it out our desired FiO2. During mechanical ventilation of a patient with COPD, the PaO2 is 50. FiO2 is set at 40%. If the desired PaO2 is 70, what FiO2 do we need to change this patient to? All right. So our equation is right up here. So you are multiplying desired PaO2 by FiO2. That's known. And then you're dividing that by known PaO2. So let's just go ahead and jump on in. Desired PaO2 we have right here. and that's 70. Multiply that by the known FiO2. We have this patient on 40%. Don't forget your decimal. And then our known PiO2 is 50. $70 times 0.4 is 28. So our FiO2, 28 divided by 50 equals 0.56, or you would say 56%. And that's going to get you the desired FiO2 to improve this patient's oxygenation status.